Let's move on and talk about the actual coverage. Okay. So within the handout, the health benefit handout, this brochure called Getting Ready to Retire starts on page H13, and it's maybe 10 pages or so, and it's a super nice, concise summary of the benefits under the retiree plan that exist without you having to read the summary plan description book, which is like 130 pages long. So this retiree health benefit brochure that's part of the handouts, or if you call for a pension application packet, this brochure is always part of the pension application packet. So if you're looking for something to reference or to have a kind of a quick read as opposed to, a 100-page book, this little 10-page brochure is really nice for the retiree health benefit coverage. As we start to talk about coverage, just like I said to you when we were talking about the lump sum, and I said, please, the partial lump sum, I said, please pay attention. This isn't necessarily taxable at 20%. Okay, this is my please pay attention to this. If you are actively eligible, for active working Carpenter benefits right now, know that the active plan deductibles or out-of-pocket maximums do not carry over from the active plan onto the retiree plan. Okay, so if you have met your active plan deductible, maybe January, February, March, and you're retired and you still have the active coverage all the way up until September 1st, once September 1st rolls around and you move from the from the active plan to the retiree plan, when your active benefits end and you move from the active plan to the retiree plan, you will have to meet a new deductible and work on a new out-of-pocket maximum. So there are two separate plans, the active plan and the retiree plan, and those deductibles and out-of-pocket maxes do not carry over. This is something that is frequently understood, and I really like to emphasize it during the seminars. Okay. If you are currently covered under the active plan, you have a network called Absolute Solutions for radiology or for imaging services. And that network, and if you use Absolute Solutions, your x-rays and your imaging services, your CAT scans, your MRIs, things like that, they're covered at 100% through Absolute Solutions. That network is not part of the retiree health benefit plan. That does not mean that your x-rays or your MRIs or CAT scans aren't covered. They absolutely are covered under the retiree through Blue Cross Blue Shield, but they are subject to your deductible and your co-payments. So they're going to be covered at 80% after your deductible. Okay, and we'll look at deductible and co-payment. So just know that Absolute Solutions doesn't move to the retirees. Currently, if you're actively eligible, you are used to calling the fund office with questions about your claims or your coverage. Okay. Once you move on to the retiree plan, Blue Cross Blue Shield of Illinois will be your new contact to ask about claims payment and coverage. Okay. You won't be calling the fund office to say, I need to check to see if my doctor bill is going to be paid or if this service is covered. You're going to be calling Blue Cross Blue Shield. Chicago Carpenters or Mid-America Carpenters now, we have a dedicated phone number, a dedicated service team at Blue Cross Blue Shield. So you'll be calling into a specific group at Blue Cross Blue Shield who knows our retiree benefits and can answer those questions for you. So you'll be calling Blue Cross Blue Shield for information about claims and coverage. But if you have questions about your premium or about adding coverage or about dropping coverage, so premiums and coverage changes, those questions do still come to the fund office, but they will come to the retirement benefits department instead of the health benefits department. Okay, the health benefits department at the fund office exclusively works with the active plan of benefits, whereas the retirement benefits department at the fund office, we deal with both pension and the retiree health benefit premiums and enrollment. So just your contact information changes just a little bit. Just something important to know because, once in a while somebody will say, oh, I didn't know I had to call Blue Cross. I didn't know I couldn't keep calling you guys. So that changes a little bit. So let's talk about coverage. Blue Cross Blue Shield coverage under the retiree plan for individuals who are not yet Medicare eligible. So for individuals who are not yet Medicare eligible, your coverage is extremely similar to the active plan Blue Cross Blue Shield coverage, or maybe right now you're not covered by the active plan, so let's look at that coverage. It is a Blue Cross PPO plan, okay? As long as you are using a PPO provider, you have a $300 deductible per person per year. If it's just the carpenter and the spouse, then each of you have a $300 deductible for $600 total. If you maybe still have dependent children younger than 26 or disabled and older than 26, there's also a $300 family out of pocket. So once three people have met, family deductible, not out of pocket. Once three people have met their annual deductible, the deductible for the family is satisfied. So our Blue Cross plan is a PPO plan. You do have the option of going out of network to a non-PPO provider, but it's going to cost you. You have a separate additional deductible of an additional $600 for if you're using a non-PPO provider. Okay. Your coverage and co-payments, if you are using a PPO provider, you have 80% coverage. The plan is going to pay 80%, and you are going to be responsible for the other 20% of the Blue Cross Blue Shield discounted rate. Because if you're using a PPO provider, before you even get charged a deductible or a co-payment, the provider's agreement with Blue Cross Blue Shield discounts the amount of the service. So that's certainly a savings to you and to the plan. So as long as you're using a PPO provider, you have 80% coverage, you're responsible for the other 20. A non-PPO provider, you only have 60% coverage of the reasonable and customary or usual and customary service charge. And you are responsible for 40% plus any charges that are over and above the usual and customary, or some people call it reasonable and customary allowance. Okay. Your annual coinsurance maximum, again, this is pre-Medicare, is $2,000 per person or $4,000 for the family. Non-PPO would be an additional coinsurance maximum of $6,000. So once you reach your coinsurance maximum, some people call it an out-of-pocket maximum, coverage under the plan goes up to 100%. So instead of this 80-20 coverage, once you've met your annual coinsurance, so per person it's really $2,300. It's $2,000 for the coinsurance and $300 for the deductible. So once you've paid $2,300 out of pocket within any given calendar year, coverage by the plan goes up to 100% for the balance of that calendar year. Again, if you are currently eligible under the active plan of benefits, many of you registered today were, this works the same way under the active plan of benefits. So it's exactly what you're used to. Okay. Emergency room copayment, you have a $250 copayment for the emergency room if you are treated and released from the emergency room. If you are admitted to the hospital from the emergency room or within 72 hours for that same condition, that $250 emergency copayment is waived. Okay, so you don't have to pay that. It's waived if you're admitted to the hospital directly from the emergency room. In all cases, and for individuals currently covered by the active plan, and I realize some of you registered today are not currently eligible under the active plan, but these coverages still apply to you. If you are covered by the active plan, you also have your HRA card, okay, it was Connect Your Care and now it's Optum Financial, so you have your little Visa debit card. If you have a balance on that card, once you move to the retiree plan, provided that you are still a member in good standing with your local, you can use up any balance that you might have on that HRA card to meet these deductibles and these co-payments. Okay, So you still have to be a member in good standing with your local. That means your dues are current, your dues are not in arrears, but you can continue to use that HRA card under the retiree plan of benefits. Okay. So this is the pre-Medicare coverage in a nutshell on one slide. It's not terribly complicated. $300 deductible, $2,000 out-of-pocket max, 80/20 coverage at a PPO provider. Stick with those PPO providers. Most people use the PPO providers under both plans of benefits. It makes sense for you and it makes sense for the plan. If you are Medicare eligible, meaning age 65 at the time your pension starts, or perhaps you are covered under the pre-Medicare plan that we just talked about on the other slide. Maybe you're covered by the pre-Medicare plan for a couple of years after you retire or several months after you retire, and then you become Medicare eligible. Once you turn 65, Medicare will become your primary carrier. Okay, William, I see your question. Give me a minute. Once you turn 65, Medicare will become your primary carrier, and your Carpenter's Blue Cross Blue Shield will become a secondary payer to the Medicare. Okay, so I find that a lot of people aren't really sure about exactly what Medicare is or what Medicare covers. It's kind of like that COBRA law we talked about a little earlier. It's kind of like this mysterious thing that people don't necessarily understand. So let's just do a quick basic overview of Medicare. There are two parts to Medicare, Medicare Part A and Medicare Part B. Medicare Part A is the part of Medicare that pays the hospital facility charges. So the room charges, the operating room charges at the hospital, your nursing care, your meals while you're in the hospital. Okay, that's all under Medicare Part A. Medicare Part B is the part of Medicare that pays the professional fees, the doctor's office visit charge, or even if you're in the hospital, what the surgeon's professional fee is to actually do the surgery. It covers lab tests, the reading of lab tests, the pathologist or the radiologist. Okay, so that's the basic difference between Medicare Part A and Part B. You can think of Medicare Part A as the hospital part and Medicare Part B really as the professional fee part, the doctor part. Well, what happens with your Carpenter Medicare supplement? Because you will move on to the Carpenter Medicare supplement once you are Medicare eligible. Well, first and foremost, you need to make sure that you have both Medicare Part A and Medicare Part B. So you need the Medicare hospital part and you need the Medicare professional fee part. Your Medicare premium is usually deducted from your Social Security check, not from your pension check, but from your Social Security check. Okay. The Medicare Part A, the hospital part, is free for most people. Okay. You have to have I believe it's 10 years, 40 credits, 40 quarters of work history in order to be eligible for the free Medicare Part A. And if you're a spouse, maybe who has not worked outside the home, that for you, that coverage plays off of your spouse's work record. And most people have had 10 years of work history. Okay. So the Medicare Part A for, I would say 99% of people, maybe 98% of people, is free. The Medicare Part B, the doctor part, the professional fees, you are going to be charged a premium for the Medicare Part B from Social Security. And for 2022, the Medicare Part B premium for individuals new to Medicare is $170.10 a month. Okay, but remember, your premium on the Carpenter's Blue Cross Blue Shield will go down. Okay, if you think back to this slide that we had where we looked at the tiered premiums, okay, and I don't want to flip back through all the slides, but if you think back to that, I showed you that the per person per month premium for someone who is not on Medicare, so Blue Cross Blue Shield for someone with 30 years of eligibility credit, Blue Cross Blue Shield is $187 a month. But once that individual becomes Medicare eligible, The premium from the plan, the $187 goes away, and you start paying $47 a month for the Medicare Supplement Blue Cross Blue Shield. So you get $140 a month back on your pension check, $140 a month less that you're paying to the pension fund for the Carpenter's Blue Cross Blue Shield, because we're no longer your primary Blue Cross Blue Shield. We're just a secondary payer to Medicare. So although you're going to start paying Medicare for the Medicare Part B, you will have some additional money back in your pocket because you won't be paying the Carpenter's health plan quite as much. So we talked about Medicare premiums. What's the coverage once you're Medicare eligible? Between the Carpenter's plan and the Medicare plan, you have excellent coverage. Okay. Medicare is going to pay for your hospital facility charges. So if you are admitted to a hospital facility, Medicare Part A, remember Part A is the hospital part, there is a $1,556 deductible on the Medicare Part A when you're admitted to the hospital, but your Carpenter's Blue Cross Blue Shield Medicare supplement pays this copayment. Okay. That pays for the first 60 days of care. So one deductible of $1,556 charged by Medicare and covered by your retiree Blue Cross Blue Shield Medicare supplement handles your first 60 days of hospital care. In the rare event that you are in the hospital longer than 60 days, Medicare requires a daily copayment of $389. Your Carpenter's Blue Cross Blue Shield Medicare supplement pays that $389 Medicare copayment. Okay. On the Medicare Part B, the doctor part, the professional fees, you have a Medicare deductible of $233 that needs to be paid before Medicare covers anything. Your Carpenter's Medicare supplement pays that Medicare Part B deductible, so you are not responsible for that. Once that deductible is met, Medicare is going to pay 80% of the remaining professional fees, and your Carpenter's plan is going to pay 20% of most Medicare approved expenses after Medicare pays. Okay. Now I say most Medicare approved expenses. There are a couple, not very many at all, things that the plan doesn't cover that Medicare covers in certain situations. Somebody's going to ask what? The only example that I can think of is it will pay for gender transition surgery. Medicare pays for gender transition surgery in certain circumstances, and your Carpenter's supplement plan will not cover the secondary charges, will not supplement Medicare for that. That is the only thing off the top of my head that I can think of that Medicare covers that the plan doesn't. This is an excellent Medicare supplement. Again, just like I talked about when we talked on the premium pages about the pre-Medicare coverage, you are most welcome to shop around for coverage. There is nothing at all that says you have to keep the Carpenter's coverage, okay? But I think you're going to find that it's a little bit tough to beat the Carpenter coverages and premiums if you shop around on the marketplace. Well, in general, you pick up Medicare when you're 65. However, if you are still eligible for the active working Carpenter plan of benefits at the time you reach 65, you can postpone enrolling in Medicare so that you don't have to pay that Medicare Part B premium. And you can postpone enrolling in Medicare until 8 months after the earlier of you stop working or your active health benefit plan ends. It's called a Medicare Special Enrollment Period, SEP, Medicare Special Enrollment Period, and it's the 8-month period that starts the clock ticking as of the earlier of when you stop working or when your active benefits end. So if you have questions about that, because it's a little bit difficult to follow and I don't have a separate slide on it, please give the Retirement Benefits Department a call and we can talk with you, or even give Medicare a call to talk with them about the special enrollment period if you are already 65 or older than 65 and still covered by the active plan of benefits.